Stimulation of the prefrontal cortex reduces intentions to commit aggression. Written by Olivia Choi, Adrian Rain, and Roy H. Hamilton. Impairment to the prefrontal area of the brain is a well-known risk factor for engaging in aggressive behaviors. Head injury and lesion studies have shown that subjects with damage to their frontal cortex exhibit more aggressive behavior. Previous neuroimaging studies have also shown that prefrontal deficits are common in individuals with antisocial personality disorder. The frontal cortex is involved with regulating violence pertaining to both physical and sexual assault. A review of 43 neuroimaging studies found that impairment to the dorsolateral prefrontal cortex is involved with antisocial behavior. This relationship is more prominent on the left side than the right side of the dorsolateral prefrontal cortex. This area of the cortex plays a role in moral judgment, which can then influence the likelihood to engage in aggressive behaviors. Other studies have found that lesions to this area are related to apathy and lack of emotion. The dorsolateral prefrontal cortex is not the only brain region that influences aggression. Prior studies provide evidence that the ventral medial prefrontal cortex and the anterior cingulate nucleus are also involved. Many of these prior studies have been correlational. Little is known about the causal role of the prefrontal cortex on aggression, but 3 previous studies have tested the upregulation of the prefrontal cortex on aggression. The Taylor aggression paradigm was used to measure aggression in subjects, and transcranial direct current stimulation is used to upregulate the prefrontal cortex. Transcranial direct current stimulation is non-invasive. It delivers a low-intensity electrical stimulation to the chosen cortical region. The findings of these studies have been mixed and inconclusive. One of the studies found that increasing activity to the left dorsolateral prefrontal cortex increased aggression while subjects were angry. But another study found that increasing activity to the right dorsolateral prefrontal cortex reduced aggression in male subjects. The third study found that upregulating the inferior frontal cortex did not significantly affect aggression. This study seeks to determine if upregulating the prefrontal cortex using transcranial direct current stimulation will reduce intent to commit an aggressive act. A larger sample will be used than in previous studies. We will also determine if upregulating the prefrontal cortex will improve judgment of moral wrongdoing, which in turn may affect intention to commit aggressive acts. The study is a double-blinded, placebo-controlled, stratified, randomized trial comparing subjects that received TDCS intervention to a sham control group. Baseline assessments were completed, then one session of TDCS intervention or the sham control was conducted. The following day, outcome measurements were assessed for intention to commit aggression, perception of moral wrongfulness, and behavioral aggression. 81 healthy adult participants were used. A one-way analysis of covariance controlling for baseline aggression levels determined that the TDCS treatment group reported a significantly lower likelihood to engage in aggression as compared to the sham control group. Intent to commit physical and sexual assault were lower in the treatment group. But there is no significant difference in the behavioral aggression assessment. There was also no significant interaction effects between treatment group and sex or ethnicity. An analysis of covariance also showed that the TDCS treatment group perceived aggression as more morally wrong than the sham control group. Specifically, the TDCS treatment group considered acts of sexual assault significantly more morally wrongful than the control group. However, there was no significant difference in perceived moral wrongfulness of physical assault. Higher ratings of moral wrongfulness mediated the decrease in intent to commit an aggressive act after controlling for perceived moral wrongfulness. Treatment and control group was not a significant predictor of aggressive intent. Perceived moral wrongfulness accounted for 31% of the effect of treatment group on overall aggressive intent, but perceived moral wrongfulness accounted for 56% of the effect of treatment group on intent to commit sexual assault. Subjects did report that the TDCS treatment had minor adverse side effects like lightheadedness, slight burning sensation, itchiness, and fatigue. This study tested a new technique to reduce violent behavior. Individuals in the transcranial direct current stimulation treatment group reported significantly lower likelihood to commit physical or sexual assault as compared to the sham control group. This relationship was partially mediated by perception of the acts as morally wrong, especially sexual violence, which resulted from the prefrontal cortex upregulation. This finding adds to our understanding of the causes of sexual violence. It also supports the neuromoral theory of violent behavior, which states that violence is in part due to impairments to the brain areas involved in moral judgment and emotion. This study provides evidence that moral judgment plays a greater role in intentions to commit sexual assault than physical assault. Moral judgment likely plays an important role in the relationship between the prefrontal cortex and aggressive acts. There was an interesting difference between intent to commit aggression and behavioral aggression. Subjects in the transcranial direct current stimulation treatment group showed significantly lower likelihood to commit aggressive acts, but also showed a non-significant increase in behavioral aggression. Since the treatment and control groups did not significantly differ in aggressive behavior, it is likely that more than one session of transcranial direct current stimulation is necessary to observe behavioral changes. The transcranial direct current stimulation was also only tested on a healthy population of adults in this study. Individuals suffering from psychiatric disorders affecting aggression may show different outcomes, as may children. Since moral judgment and intent to commit aggressive acts were measured simultaneously, it is not possible to establish the temporal precedence of the mediator and outcome. Outcome measurements were taken 1 day after the transcranial direct current stimulation. Future studies should test outcome measurements at later times to assess the long-term effects of the treatment. Also, no laterality effects were studied in this experiment. Future research should assess if stimulating the left versus right side of the prefrontal cortex yields different outcomes. This is a promising new approach to reducing aggression, which is a feature in several mental disorders, like antisocial personality disorder, conduct disorder, and borderline personality disorder. This study provides evidence that transcranial direct current stimulation can possibly be used as an intervention on aggressive and antisocial behaviors for afflicted adults and children.